The Golden Age of Piracy, which spanned from approximately 1650 to 1730, was a time of great upheaval and lawlessness on the high seas. Pirates roamed the oceans, preying on unsuspecting ships and amassing vast fortunes in gold, silver, and other precious commodities. However, amidst the swashbuckling adventure and daring exploits, there existed a more mundane, yet equally crucial, concern: dental care. For pirates, maintaining good oral health was not merely a matter of vanity, but a necessity for survival. A severe toothache or abscess could render a pirate unable to perform his duties, leaving him a liability to his crew and a potential burden on the ship's resources. The creaking of wooden ships and the salty spray of the ocean filled the air as pirates went about their daily lives, often neglecting their oral health in the process. The diet of a pirate, consisting of hard-tack biscuits, salted meat, and sugared rum, known as grog, was a perfect recipe for dental disaster. The lack of fresh fruits and vegetables meant that pirates were often deficient in essential vitamins, making them more susceptible to dental problems. As a result, toothaches, cavities, and gum disease were rampant among pirate crews. The ship's surgeon, a role sometimes filled by a man with formal apprenticeship, but often by someone with only battlefield experience, was expected to handle everything from amputations to tooth extractions. His medical chest, if he had one, contained a haphazard assortment of tools, many of which were repurposed from other trades. The surgeon's hands, though well-intentioned, were often unsteady and lacking in finesse, making the already daunting task of dental care even more perilous. "I've seen men cry like babies when they've had to have a tooth pulled," said one grizzled old pirate, his voice like the creaking of old wooden planks. "And I've seen others, tough as nails, take it like a man, without so much as a whimper." The old pirate spat a wad of chew into the ocean, his eyes glinting with a mixture of nostalgia and pain. "But either way, it's a bloody business, and one that'll leave you shaking in your boots." The challenges these men faced were immense. First, there was the complete absence of effective anesthesia. A patient might be given a swig of rum to dull the senses, but the procedure itself was fully felt. Second, the tools were crude and frequently unsanitary. The iconic instrument for tooth extraction was a pair of dental pliers, often called pelicans or keys, due to their shape. These were not the precision instruments of a modern oral surgeon. They were heavy, iron tools, sometimes crooked from repeated use, designed to clamp onto a tooth crown and lever it out through sheer force. Sterilization was an unknown concept. The same pliers might be used on multiple crewmen, wiped clean on a dirty rag between patients. The risk of post-operative infection was extraordinarily high, given the filthy conditions aboard ship and the general lack of understanding about germs. Beyond extractions, the pirate surgeon's repertoire for dental issues was limited to folk remedies and superstitions. Some might attempt to pack a cavity with wax, lead, or even a mixture of herbs and spices. Others believed in the power of rinsing with salt water or various alcoholic tinctures. There are accounts of attempts to smoke out a toothache by holding burning tobacco near the gum line. These methods were born of desperation and a complete lack of effective alternatives. They highlight the grim calculus of pirate life. The risk of a painful, potentially lethal infection from a botched extraction had to be weighed against the unrelenting agony of an untreated abscess. As the sun dipped below the horizon, casting a golden glow over the pirate ship, the crew gathered around the capstan, their faces lit by the flickering torches. They spoke in hushed tones of the dangers that lay ahead, of the battles to be fought and the treasures to be won. But, amidst the bravado and the swagger, there was an underlying sense of fear, a fear of the unknown, and a fear of the pain that awaited them. For in the world of the pirate, pain was a constant companion, and relief was often more terrifying than the ailment itself. The brutal dental care of pirates was a stark reminder of the harsh realities of life on the high seas, where survival was a daily struggle, and death lurked around every corner. The reality of dental care on a pirate ship during the Golden Age of Piracy was stark and unforgiving. There was no gentle numbing gel, no precise instruments, and certainly no comfortable chair. The primary tool for addressing a throbbing, rotten tooth was a pair of pliers, often described as crooked or crude. These were not medical instruments, but tools repurposed from the ship's maintenance kit or a carpenter's chest. The procedure was straightforward in its brutality. A fellow crew member, perhaps the ship's barber if one was aboard, or simply the strongest man with the steadiest hand, would take hold of the offending tooth with the metal jaws. With a firm yank, he would attempt to pull the entire tooth free from the socket. There were no painkillers beyond a stiff drink of rum, and even that was a luxury not always available. The goal was speed, not comfort, and the success of the extraction depended entirely on the strength of the pull and the integrity of the tooth. A tooth might shatter, leaving fragments of enamel and root embedded in the gum, which would almost certainly lead to a severe infection known as an abscess. As the crew member grasped the pliers, the air would be thick with tension. The pirate undergoing the procedure would grit his teeth, bracing for the pain that was to come. The sound of the pliers closing around the tooth would be like a vice, and the smell of sweat and fear would hang heavy over the scene. "Hold steady, mate," the crew member would say, his voice low and reassuring, as he prepared to make the pull. The pirate would nod, his eyes fixed on some point beyond the horizon, as he steeled himself for the agony to come. The lack of available treatment was a defining feature of life at sea. While larger vessels of the British Royal Navy or wealthy merchant companies might carry a trained surgeon, such a professional was a rarity on pirate ships. A pirate captain prized skills like navigation, gunnery, and hand-to-hand combat far above medical knowledge. Therefore, dental problems, like many other ailments, fell to the crew to solve amongst themselves. If a man developed a bad cavity or a tooth cracked on hardtack biscuit, his options were grim. He could endure the escalating pain, which could become so severe it incapacitated him, rendering him useless during a chase or battle. His other option was to seek out the man on board known for pulling teeth. This was not a formal position, but rather a reputation earned through grim necessity. The consequences of poor dental health extended beyond individual suffering. A crewman with a festering tooth infection could develop a fever, become delirious, and spread sickness to others in the close quarters below deck. In an environment where every able-bodied sailor was critical to the ship's operation, losing a man to a toothache was a serious logistical problem. It was a vulnerability no captain wanted. "We can't afford to have you laid up with a toothache, Tom," the captain would say, his voice firm but concerned. "We need every hand on deck if we're to catch that prize." The aftermath of an extraction was often as dangerous as the procedure itself. The raw, open socket left behind was a direct pathway for bacteria into the jawbone. Without any means of proper cleaning or sterilization, infection was nearly inevitable. Pirates had no concept of germs, but they understood the signs of a wound turning bad. The gum would swell, become red and hot to the touch, and pus would form. This abscess could cause the jaw to swell grotesquely, lock, shut, or even lead to a systemic blood infection. In severe cases, the infection could eat into the bone of the jaw itself, a condition known as osteomyelitis, which was frequently fatal in that era. The only further treatment available was perhaps lancing the abscess with a hot knife to drain the pus, which offered temporary relief but did not address the root cause. For many pirates, a simple toothache could begin a slow, painful decline that ended in death, far from the dramatic end they might have imagined in battle. This constant shadow of mundane suffering underscored the harshness of their existence, where a minor dental issue could become a mortal threat. As one pirate would say, "A toothache can be a death sentence, mate." Don't ye forget it. The dental problems that afflicted pirates during the Golden Age of Piracy were a constant and debilitating presence, directly impacting a pirate's ability to function on a ship. The lack of oral hygiene and the diet of hardtack biscuits, sugar, and rum created a perfect storm of dental disasters. Cavities were rampant, and a pirate with a deep cavity would face escalating agony, from sharp pains when biting down on something sweet or cold, to constant and throbbing pain that radiated through the jaw and into the ear. The consequences of these dental problems were far-reaching and profound. A pirate with a bad tooth could not eat properly, leading to malnutrition and weakening the body. Chronic bad breath, or halitosis, was a constant companion, making a sailor unpleasant company in the cramped quarters of a ship. The pain affected mood and temperament, turning normally reasonable men into short-tempered and prone to fights over the smallest provocation. For a pirate captain, maintaining discipline and crew morale was hard enough without half his men being in a foul mood from persistent toothaches. The absence of mild options and intermediate treatments meant that pirates had to resort to brutal solutions, such as extraction by any means necessary. The choice was between indefinite suffering or a few moments of excruciating, concentrated agony. Many pirates, after nights spent awake sweating through the pain, would seek out the man on the ship with the strongest grip and the most reliable tools, often the carpenter or the cook, and ask for the pliers. This request was an admission of defeat, a surrender to the only remedy the high seas offered. In this desperate world, pirates had to rely on the limited medical knowledge and skills of their crewmates. The carpenter or cook, with their strong hands and reliable tools, became the de facto dentists on the ship. They would use pliers to extract rotten or damaged teeth, often without any painkillers or anesthesia. This brutal dental care was a far cry from the modern dentistry that we take for granted today. The pirates' dental problems were a constant reminder of the harsh realities of life on the high seas, where the lack of proper medical care and the demands of a brutal and unforgiving environment made even the simplest tasks a matter of life and death. As the pirates sailed through the Caribbean, their dental problems became a major concern. The scarcity of fresh food and the abundance of sugar and rum in their diet made them prone to cavities and gum disease. The lack of proper oral hygiene and the absence of professional dentists on the ship meant that pirates had to rely on their own resources to deal with their dental problems. This led to a culture of self-reliance and resourcefulness, where pirates had to use their wits and whatever tools they had available to treat their dental ailments. The use of pliers to extract teeth was a common practice among pirates. The pliers were often used in conjunction with other tools, such as hammers and chisels, to break and remove the tooth. The process was often painful and bloody, and the pirates had to be careful not to damage the surrounding tissue or cause infection. Despite the risks, the use of pliers remained a popular method for dealing with dental problems, and many pirates became skilled in their use. The pirates' dental problems also had a significant impact on their social lives. The chronic bad breath and the pain from toothaches made them unpleasant company, and many pirates became isolated and withdrawn. The lack of proper medical care and the reliance on brutal solutions also created a sense of desperation and hopelessness among the pirates. Many felt that they were at the mercy of their dental problems and that their lives were dictated by the whims of their teeth. In conclusion, the dental problems of pirates during the Golden Age of Piracy were a major concern that affected every aspect of their lives. The lack of proper oral hygiene, the scarcity of fresh food, and the abundance of sugar and rum in their diet made them prone to cavities and gum disease. The absence of professional dentists on the ship and the reliance on brutal solutions, such as the use of pliers, created a culture of self-reliance and resourcefulness among the pirates. The pirates' dental problems were a constant reminder of the harsh realities of life on the high seas, where the lack of proper medical care and the demands of a brutal and unforgiving environment made even the simplest tasks a matter of life and death. The use of pliers to extract teeth was a common practice among pirates, and many became skilled in their use. However, the pirates' dental problems also had a significant impact on their social lives, creating a sense of desperation and hopelessness among them. The experience of a severe toothache aboard a pirate ship in the 17th century was a uniquely harrowing ordeal. It began not as a localized discomfort but as a consuming, throbbing presence that grew with each passing hour. The pain would start as a dull ache, a persistent nuisance amid the constant labor and noise of the ship. But without any form of intervention, it would inevitably escalate. It would sharpen into a jabbing sensation with every bite of hardtack, then pulse in time with the sailor's own heartbeat, until it became a blinding, all-encompassing fire in the jaw. There were no painkillers as understood today. A pirate might swill rum to dull his senses, but the spirit was acidic and could irritate the problem further. He might press a cloth soaked in cheap brandy against his gum, a futile gesture against the deep, septic infection raging at the root of the tooth. For days or even weeks, he would work his watch in agony, his focus narrowed to the pounding in his skull, his mood turning foul and dangerous. The toothache became his entire world, a private torture conducted publicly on the open deck. The only solution was extraction. On a larger vessel, the afflicted man would eventually present himself to the ship's surgeon or the barber who served that role. These men were not dentists. They were general practitioners of crude, practical medicine. Their knowledge was based on battlefield trauma and the rudimentary surgical texts of the era. Their tools were few, multi-purpose, and rarely cleaned beyond a wipe on a rag. For a rotten tooth, the treatment protocol was brutally simple. Remove the source of the trouble. The surgeon would examine the mouth, often by the dim light of an oil lamp below decks, and identify the offending tooth. If it was loose, the job might be quick. If it was a sturdy molar, firmly anchored but decayed from within, the procedure became a physical contest. The primary instrument was a pair of dental forceps, often just called pliers. These were not the fine, articulated instruments of later dentistry. They were frequently repurposed tools, blacksmith's pliers, carpenter's pincers, or a crude iron claw designed for grabbing and pulling. Their jaws were thick and meant for gripping metal or wood, not for fitting neatly around the complex geometry of a human tooth. The extraction itself was a raw exercise in biomechanics and suffering. The surgeon would clamp the iron jaws around the crown of the tooth. He would tighten his grip, often crushing the enamel in the process. Then, using his full body weight and strength, he would begin to rock the tooth back and forth, wrenching it from its bony socket. There was no consideration for the delicate periodontal ligament. The goal was to break it through sheer force. The sound was often a sickening crunch followed by a tearing sensation felt throughout the man's skull. The pain was absolute and unmitigated, a white-hot spike of agony that could cause even the toughest pirate to scream or pass out. The process could take several minutes of sustained, brutal effort. If the tooth shattered, which was common, the surgeon would then have to dig into the bleeding gum with a probe or a knife to fish out the remaining root fragments. Success was measured solely by the removal of the visible tooth, not by the cleanliness of the socket or the patient's comfort. The aftermath of the procedure was almost as dangerous as the pain that preceded it. The socket was a deep open wound in a part of the body teeming with bacteria. The tools were not sterilized. They carried residues from previous extractions, from the workshop, or from the rust of the sea air. Infection was not a risk. It was a near certainty. The condition known as dry socket, where the blood clot is dislodged and the bone becomes exposed, was a common and excruciating complication. More severe infections could lead to abscesses that burrowed into the jawbone, a condition called osteomyelitis. From there, bacteria could enter the bloodstream, causing sepsis. On a pirate ship, far from any proper hospital, sepsis was typically a death sentence. A fever would set in, followed by chills, confusion, and organ failure. Thus, a simple toothache could, and often did, become a fatal condition. The crude solution of pulling teeth with pliers was a desperate gamble, trading immediate, traumatic pain for the high risk of a slower, more systemic death. It was a stark illustration of a fundamental truth of that era. Minor medical issues could swiftly become mortal threats in the absence of effective care, sterile conditions, and scientific understanding.